Hello, Dr. Dooley here at Lifetime Hearing Clinic, and we just wanted to go over some tips about cleaning your receiver in the canal hearing aids at home. So, this is a receiver in the canal hearing aid, the most popular style. The hearing aid itself sits back behind the ear with the microphones located right there at the top of the ear. And then you have the thin wire that comes down. The only part that goes down in the ear is this soft dome. And then this portion is just going to sit in the floor of the outer ear just to help to keep the hearing aid locked into place. So oftentimes the repairs that we see here at our clinic, almost all the time, just occlusion of wax in the speaker. And if you're diligent about cleaning this at home, it can really cut down on frustration and repair issues. So the first thing you want to do is just every time you take the hearing aid off, just wipe it off with a soft, dry cloth. You have to remember this is where the sound is coming out. And if this gets occluded with wax, sound can't come out. It's like a plug blocking the sound, and it can make the hearing aid sound weak or even dead. So just take a soft, dry cloth, and you just want to make sure any wax, you just sort of rub off to make sure that that dome stays clean. Some of the manufacturers also have a hood located on the dome, and that hood acts as a protectant. So as you are putting the hearing aid into the ear canal, if there's any wax, it prevents it from scooping up into the speaker, and the sound is actually coming out from underneath the little hood. So there are these little wire loops, and what you're going to do is take the wire loop, get underneath the hood as if you are threading a needle, and there you go. You just want to make sure that that stays up so that the sound can come out and that it's free of wax underneath. You can even take your fingernail and kind of flick it. Just make sure there's nothing blocking where the sound is coming out underneath the hood. Now the dome can come off. It's difficult to pull it off, and the reason is because we don't want it to come off in your ear. So what you can do is take your soft dry cloth, get underneath it, and actually peel it off. That's the easiest way to remove it. Once you remove the dome, this little white thing right here is a basket. It's called a wax guard. And what happens is anything that has made it past the dome or the hood, it catches it in this small basket before it gets too far down into your speaker. These are so tiny, there really is no way to clean it. We just want to change them periodically. We tell our patients just at least once a month, even if you feel like you're doing okay, you feel like it sounds okay, just to be proactive, go ahead and change out those wax guards. Most all of the manufacturers use a very similar type of wax guard at this point. You might have something like this in your hearing aid case and might be thinking, I don't remember what that is. If you take this out, you can open this up, and there are the little sticks with new wax guards. So if you look, one end of the stick has a new white wax guard. If you turn it around to the other side is empty. What you're going to do is on your speaker, you're going to take the end that's empty, and there's a hole right there in the center where the sound comes out. You're just going to poke directly into the hole, pull straight out, the old wax guard comes out, then you're going to turn the stick around and go straight in with the new one. Then we're just going to toss this in the trash. So now you've got your new wax guard on there. Now we need to put the dome back onto the hearing aid. If you look, the underside of the dome has a little hole. The dome is shaped like a teepee. So what I do, take these two fingers, put it on top of the teepee, and then underneath is the little hole where this fits. Kind of line that up and then push down with those two fingers, and you'll see that the dome is securely back on. Now what's very important is once you put your dome back on, you want to do a tug test and make sure that that dome is on securely. If it's not on securely, you don't want to put it in your ear. We do see people coming in with domes that have come off into their ear, and it's simply because they took the dome off to clean it and didn't get it back on correctly. So if you do that tug test, you can make sure it's on there and won't come off in the ear canal. The retention wire here, sometimes we see people come in and the retention wire has slid so that they can't get the hearing aid completely down into their ear canal. What you can do is just take that and you can slide it back. You want this to stay in the back position on that speaker so that it allows for complete insertion of the hearing aid into the ear canal. And then these little domes can invert. If they invert, no big deal, just flip them back the other way. The last thing we definitely need to keep clean are the microphones here at the top, and we do have a lot of people that just forget about cleaning those microphones. So what can happen is these microphones can get filled up with skin flakes, debris, and if this fills up, the sound can't even get into the hearing aid to be processed. So the best way to clean that is to just hold that upside down where those microphones are, and then we're going to take a little brush and we're just going to back and forth, making sure the microphones are down, and what you'll begin to see are just some skin flakes that will fall, making sure that all those look nice and clean. And you can even visualize it. If you see some debris, just be aggressive about making sure all of that gets clean. And now you are finished.